Good evening and thank you for joining me on Black News Tonight. I'm Mark Lamont Hill. Turning now to the trial of 3 white men charged in the killing of Ahmaud Arbery. Jurors hearing from the medical examiner today and defense attorneys formally filing a motion requiring everyone from the public who visits the courtroom to be documented. BNC's Dre Clark has the latest.
Jurors were shown graphic pictures of Ahmaud Arbery's fatal wounds.
All right, doctor, please state your name and spell it for the record.
Dr. Edmund Donahue, a forensic pathologist, performed Arbery's autopsy. He testified Arbery was shot at 3 different times, but only 2 bullets struck his body. The first shot struck the middle of Arbery's chest and grazed his right wrist, causing severe bleeding. The last shot also struck Arbery's chest and his left armpit, hitting a major artery. His body was also riddled with shotgun pellets.
The gunshot wound to this torso, was that a fatal gunshot wound? If he had never gotten this one under the arm, would that one in the middle of his torso have killed him?
Yes.
The doctor told jurors this picture showing Arbery's arm locked in the straight position with his wrist slightly twisted reveals he had a sudden case of a condition called Erb's palsy.
He's paralyzed now, can't use that arm.
Based on video of the shooting, Donahue said it appears Arbery suffered a close-range or near-contact shotgun blast. Still, he said Arbery was able to grab the gun and hit the shooter with his uninjured arm. But the video also shows Arbery collapsing. Donahue said Arbery was losing consciousness as he hit the ground face first.
Is there anything they could have done on scene to save his life?
No.
Gregory and Travis McMichael, along with William Bryan, are on trial for multiple charges, including murder. Arbery's family says he was out jogging when the 3 white men chased him, claiming he was a neighborhood burglary suspect and they were going to make a citizen's arrest. Yet, in their own words, they had no evidence of Arbery stealing anything. Gregory told investigators they had Arbery trapped like a rat, and that's when Travis shot and killed Arbery with his 12-gauge shotgun, claiming it was self-defense.
We got to get justice to make this thing right, so this kind of stuff will never happen to nobody.
I'm Dre Clark for Black News Tonight.
A new study out of UCLA is proving something that many of us already know. Racism takes a significant toll on mental health. According to the data, discrimination can cause lifelong damage for young adults, leading to worse health overall. BNC correspondent Walter Morris has the story from Los Angeles.
I think we were hoping to just get a better understanding and provide numerical evidence showing intuitive thought that, things such as discrimination will lead to poor health outcomes.
It's a study that backs up what many in Black and brown communities have known for years. Discrimination and racism can cause significant damage to your mental health and take a serious toll on your overall wellness.
So I've always been really interested in looking at things on a more social science and looking at a more systems-based understanding of how our world works and how healthcare works.
UCLA student Yvonne Lay is the lead author of the study Discrimination and Subsequent Mental Health, Substance Use, and Well-Being in Adults. She says after looking at 10 years worth of data for over 1,800 Americans, they discovered young adults who face frequent discrimination were 25% more likely to be diagnosed with a mental illness, experience psychological distress, or engage in excessive drug use. According to the study, the greater the exposure to discrimination, the higher the risk for behavioral problems, with discrimination based on appearance, sex, and race causing the most damage.
It was interesting that we were able to find such a robust association across all of these different types of discrimination.
Researchers looked at people ages 18 to 28 for the study because Lay says that's a critical time in every adult's life.
There are so many disparities in terms of who gets access to mental health care, and once people are able to see a provider, there are so many disparities in diagnoses and treatment, especially in something as subjective as mental health.
In Los Angeles, I'm Walter Morris for Black News Tonight.
Online retailer Amazon once again making headlines. It has agreed to pay $500,000 for failing to tell employees about COVID-19 outbreaks. This decision comes a year after California's Attorney General's office opened an investigation delving into workers' safety concerns. An Amazon employee filed a lawsuit claiming the company put employees at, quote, needless risk by having them share equipment and not allowing time for social distancing. Amazon will also now be required to inform employees of COVID cases within 1 day. Amazon has been under fire recently for pay concerns and worker safety. Earlier this month, Tara Jones, an Amazon worker, joined me to talk about her experience with the company after being injured and going on maternity leave. With regard to your shoulder, what did you think they'd say? What did they do that was surprising to you?
The most surprising part for me was after 4 weeks of sending me to physical therapy, their doctors refused to do an MRI or an x-ray using the point of I was pregnant and they didn't want to harm the baby. So they wouldn't even look at it at that point. So that was shocking for me that it seemed like they were pushing me back to work without actually investigating what had happened.
What if you could be vaccinated against COVID-19 without taking a single shot? Well, that's what one major pharmaceutical company is proposing. Pfizer submitted its application to the Food and Drug Administration today for emergency authorization of its COVID-19 treatment pill, which the company claims reduces hospitalization and death in patients by 89% when given with a common HIV drug within 3 days of visible symptoms. The pill, dubbed Paxlovid, if approved by the FDA, can be administered at home, which provides a significant help as hospitals and medical staffs continue to be overwhelmed by patients. Pfizer also announced it plans to share its antiviral pill for use with 95 low and middle income countries that account for 53% of the global population. Now we head over to East Africa as officials strongly condemn the domestic terror group, as they call it, known as the Allied Democratic Forces, following the horrific suicide bombings that have rocked Uganda to its core. Ugandan authorities blame the ADF for 3 suspected suicide bombers behind the deadly blast that occurred earlier today in the heart of Kampala, which is the capital city, that killed at least 3 Ugandans, including officers, while also wounding dozens and leaving at least 5 people in critical condition. The ADF has suspected links to the Islamic State Central Africa province, which has claimed responsibility for today's attack and last month's attacks in and around Kampala. Authorities are asking for residents to remain vigilant as heightened security measures go into effect due to bomb threats. We head north to Libya, where many potential voters are already calling next month's elections illegitimate. Libyans who had a hand in the ousting of late dictator Muammar al-Gaddafi a decade ago expressed skepticism now in the fairness of the presidential election that's scheduled for December 24th. Saif al-Islam Gaddafi, a son of the late ousted Libyan leader, is among the presidential candidates. And while he is wanted by the International Criminal Court, which accuses him of war crimes, he remains on the ballot. Eastern Commander Khalifa Haftar made his announcement for candidacy today, just 2 days after Saif. And he faces accusations of attempting to establish a military dictatorship in the country. And back to the Horn of Africa, the Sudanese military junta's attempt at further establishing its council has hit a snag. Sudan's recently sworn-in deputy leader of the new Transitional Sovereign Council, Mohamed Hamdan Dagalo, has turned down the duties of investigating and undoing the system that ousted President Omar al-Bashir presided over during his nearly 3 decades in power. Dagalo rejected the offer yesterday from Sudanese coup leader General Abdel Fattah al-Burhan, but he didn't give an explanation as to why he refused to head the Empowerment Removal Committee for the ruling junta of Sudan. All right, be sure to join the conversation. We want to hear from you. Head over to our BNC Instagram and Twitter pages. Let us know how you feel. Also, visit our website at bnc.tv and subscribe to our YouTube channel to check out clips from the show.